Welcome to today's program, and thank you for joining us. I am C. Virginia Fields, former Manhattan Borough President and current President and CEO of the National Black Leadership Commission on Health, formerly National Black Leadership Commission on AIDS. As you are aware, Health Action TV has been on hiatus for the past few months while the organization rebranded. As a leading advocacy organization and change agent born of 32 years of service to the Black African American community, the National Black Leadership Commission on AIDS recently announced an organization evolution to become a more comprehensive advocacy, action, and policy group that has moved beyond HIV/AIDS to address multiple health issues and disparities affecting the Black African American community. Moving forward, NBLCH is now known as the National Black Leadership Commission on Health, furthering its mission of advocacy and empowerment to include 8 key areas of disparities in Black health: HIV/AIDS, hepatitis C, cardiovascular disease, breast cancer, prostate cancer, sickle cell, diabetes, and mental health. And to celebrate our rebranding, our first show as NBLCH, we are honoring the legacy of Dr. Martin Luther King Jr. by discussing the inequity and injustices in healthcare with our 2 exciting guests today. We have Roslyn Y. Daniels, who is the president and founder of Black Health Matters, the leading health promotion and disease management online platform serving the needs of consumers, patients, and physicians. She's a tireless advocate for eliminating health disparities by improving the health literacy of African American consumers and patients. Sister Daniels is a nationally respected health strategist with more than 20 years designing and implementing cross-cultural health education programs and initiatives. We're also joined by Dr. Bert Petersen, who is the director of the Breast Surgery Clinic program at St. Barnabas Hospital in the Bronx. He also serves as the board of directors of NBLCH, treasurer, and he co-founded the Charlotte Kimelin Cancer Institute, the first regionally based comprehensive cancer center in the Caribbean on his native island of St. Thomas. Dr. Petersen is fully committed to eliminating racial disparities in cancer through educating minority women about the importance of early detection and prevention of breast cancer. Welcome to both of our guests, and I'm just so excited to have you here. And before I ask you a few questions about, and we go into some discussion about your organizations, how you got into that, let me just share a little information about the status of African Americans and what we're seeing, and that also helps to kind of help our viewers know why we made the change. According to the Center for Disease Control, African Americans are living longer. The death rate for African Americans has declined about 25% over 17 years, primarily for persons aged 65 years and older. But even with these improvements, new analysis show that younger African Americans are living with or dying of many conditions that are typically found in white Americans at older ages. The difference shows up in African Americans in their 20s, 30s, and 40s for diseases and causes of death. And we all know that when diseases start early, they can lead to deaths earlier. Chronic diseases and some of their risk factors may be silent or not diagnosed during these early years. Health differences are often due to what we talk about as social structures, social determinants, social factors, and economic conditions that are more commonly among African Americans than whites. Poverty, lack of education, unemployment, mental health, lack of access to health care. All of these factors we know affect health care. And although there have been improvements in the general health of the U.S. population over the past 5 years, racial and ethnic minorities still do not achieve equal health care. And again, some reasons for racial and ethnic health disparities include decreased health knowledge, lower priority given to preventive health, poverty, lack of access to quality health care. And it was in the words of Dr. King more than 54 years ago, of all the forms of inequality, injustice in health is the most shocking and inhumane. And I will say that a great deal of this is what led the National Black Leadership Commission on AIDS then to become the National Black Leadership Commission on Health. Because as we did our work around the country, we recognized, and now obviously for some time, HIV does not stand alone. There are comorbidities to HIV, including all of the other 6 areas of focus health areas that we've included, including mental health, HIV and mental health, HIV and cardiovascular disease. So we thought it was very important for the larger public to know exactly what we do, the focus of our work, and to highlight the importance of advocacy. And we do that through community mobilization, organizing communities broadly through all sectors, because we've always said in the Black community, all hands must be on deck. The consumers, the providers, the pharmacists, and everyone who has a hand in health care. So looking at advocacy, looking at policy, needing to change policies quite often in order to make a difference, and then taking action. So that's what we are championing in order to help eliminate health disparities and achieve health equity. So your being here present with, pardon me, being present with us today just helps to highlight this. And again, in thinking about 54 years ago when Dr. King even talked about injustice in healthcare being inhumane. I'm delighted that you're here. So let us start with you, Roslyn, ask you why black health matters. What were you seeing that led you to create this platform specifically to the Black community, and what impact can you say now, and how old is the initiative or the program, and what impact are you seeing?
So
welcome, first of all.
Thank you very much, and Happy New Year.
Happy New Year to you.
So we launched Black Health Matters because we wanted to make sure we had a trumpet or a rallying cry, that we understood that Black health was important, and that we ourselves are important, and we need to have more value. So in 2012, we saw that the Affordable Care Act became a reality. So obviously we were really excited because all Americans would have access to health and wellness services. Women or men, women who never thought they would have access to a mammogram can now do it and not have to pay a king's ransom. Other services would now be affordable that maybe you never thought you would have access to before. But all of that does not matter if you don't have an understanding of the fundamentals of basic health behavior. Such things as exercising, drinking water, resting, reducing stress. All of these things help so that you can lead a healthier life. And so we wanted to be able to offer information in a self-reflective format to help all of these new people who would be interested in health and could realize a healthy lifestyle by providing information so that they can improve their health literacy as they embark on their health journey.
And so when was Black Health Matters launched again?
In 2012.
2012.
Yes.
So that's now what?
Almost
8 years?
8, yeah.
We're going into the 8th year now.
Yes,
Yeah.
yes.
And what has been your experience? How has it been received, and what kind
That's
of...
a very interesting journey, because 8 years ago, and of course, you can't just pop up with a website and
Right.
expect it to have millions and millions of impressions every day. And to be honest with you, we're still growing, we're still evolving. I joke around and I say, now, if I had a website that talked about Beyonce and Blue Ivy, I'd be rich, because we have an insatiable desire to learn about celebrities, which is fine. But health is something that we really had to kind of knock on doors and market and promote, as you know, because you have an organization as well. So when we first started promoting...
And I just want to say something about that too. And health is one of those things that you don't know how valuable it is until you don't have it anymore. So
Right,
that's,
right.
you know,
Or
yeah.
a family member is stricken, so exactly.
yeah.
So when we first started, we would kind of creep into Facebook, right? Because that's a great way to spread awareness. So we would go into this little chat room or that chat room. If it was a group about women talking about natural hair, which we love to talk about natural hair, we might jump in and say, well, if you exercise and get your heart and your cardiovascular system revved up, your hair may be a little more healthy. And they would report us, and Facebook would shut us down for weeks at a time.
Why?
So, because they would report us. They didn't want to have health information in their chat room. We would creep into a parenting group. We might say something about, learn more about how your child evolves, or, are they having learning disabilities? What is ADHD? All of these things. So we would try to pepper the market with content, and we would always be shut out and reported. Now, we can go into any chat room with information relevant to that community, and they accept it and they share it. So we really feel that there's been a changing tide, that people are much more interested in being, I think we've always wanted to be interested in being healthy, but now we're looking for the tools to help us be healthy.
Oh, that's really exciting.
it is,
That
yeah.
is very exciting. Okay, Dr. Petersen, as a medical provider on the front line, certainly of breast cancer in an urban setting, your commitment to the work that you're engaged with in Black Health, National Black Leadership Commission on AIDS, obviously has been very invaluable and crucial to our evolution as we are now moving forward under this rebranding. So could you talk with us specifically about what Black health looks like through the eyes of a physician working in the community?
Well, it's really interesting because we brought up the Affordable Care Act, and people talk about and champion a lot about equal access to health care, but there's a very important word for me that must be put into that phrase, and that is equal access to quality health care. Because one of the things that has plagued our community is whether we have access to health care or not, is it the health care that we actually should be having? Because oftentimes where we are ushered into to get our care doesn't actually provide state-of-the-art care, doesn't provide the gold standard that we're having, that should be offered to our patients right now. And the providers who are providing that care aren't necessarily the best trained to provide that care either. So one of the things that's very important to me is that our people, that is Black people, that they have equal access to quality health care. And that has always been the thing that I've championed. For example, if we just take in the Bronx, where I serve, I actually practice in the South Bronx, and things from my Navigator program to make sure that the women get into getting the proper mammograms. We have the first all 3D mammography and biopsy program in the South Bronx, okay, which is state-of-the-art mammography. And we have the only, mobile mammography program. We actually provide quality health care, such that I'm actually proud to say, just by doing that, our early detection rate for breast cancer, for example, has beat every zip code in the New York City area. The South Bronx, we beat the Upper East Side, Upper West Side, Gramercy, Wall Street, Staten Island, the South Bronx, by providing quality health care. And I think that's the important piece. As a physician, I'm always looking for, is what you're offering this community a match for what you would offer any place else? And that means we need to recruit quality providers. We need to be offering quality health care that is proven by research that this is the gold standard of care. And I think that's really important.
So how do we get to that in all of these other communities, certainly that Roslyn is outreaching through her platforms, as well as the work that we're doing through this organization? And I raise that because I think we would all agree education and prevention is perhaps the hardest part of this work. I mean, if a person obviously is sick and they get medication, they get treatment and care, we can evaluate if they're doing better or not. But getting people to listen and to ask questions, even as they go to physicians about the care that they are given. How do we break through so that we can see what you have experienced in the South Bronx in more of our communities right here in New York City?
Yeah, well, you know, when we look at how to get healthcare messaging out, there are certain strategies that work better in various different communities and others. For example, in the African American community, we know that getting healthcare messaging out through women always works. The women in our community, if we educate the women in the African American community, we're going to get, the messaging gets out to the entire family. We also know, for example, if that messaging comes out through the Black church, which was the roots of the National Black Leadership Commission on AIDS, that the church is also an effective way. Community organizations that we trust, fraternities, sororities, and now we have an organization like Black Health Matters. Once we trust that organization, it's an effective way to get the information out. And as it relates to quality health care, if Black Health Matters, an organization like that, starts to say, this is where you should go for your care, because let me tell you what they offer, and they start to educate people, these kinds of strategies are very important.
And especially now, since Black Health Matters can get into all these chat
Exactly.
rooms. They were excused
Yeah,
before.
exactly, yeah.
So, Roslyn, I know that in addition to the digital platform, you're also involved with a variety of activities, conferences, and I know you have something coming up in Atlanta soon around prostate cancer, I think with Kappa Alpha Psi fraternity.
I have to say something about that
Okay.
because I'm incredibly proud of that initiative. And of course, you know, when I'm between friends, we joke and we're saying, wow, we're women of a certain age.
Yeah.
We're all single. We would love to date. We're the fellas. And then we were like, wait a minute. Why not start an initiative to help them be healthier?
Be healthy, all right.
That's what we joke around and say.
Prostate cancer, very interesting.
But what we do know, when you look at the statistics for the health of African American men, you can't help but feel like there's something that has to be done. Because yes, African American women are raising their hands.
Yeah.
We think of ourselves and we are the chief medical officers for our families.
That's right.
But African American men, because, like to your point, the social determinants of health have it so that African American men don't want to show vulnerability. They don't want to raise their hand if they're not feeling well. Health-seeking behavior is frowned upon. So what happens when a man starts to not feel well? They don't understand that we need them strong and healthy, not breaking down later on in their senior years. So we worked with Kappa Alpha Psi fraternity to launch a program called Precision Oncology to help educate African American men about prostate health, prostate cancer, and why clinical trial participation is important. And so we're doing that with Kappa Alpha Psi chapters across the country with the idea that Black men modeling behavior with other Black men saying, I'm going to get screened, I'm going to talk to my doctor. It's going to be so much more effective than a commercial or a pamphlet that they find. Us talking to each other will help to elevate the conversation, and we're hoping to see better outcomes.
And Virginia, if I may say something, this is an example of what I mean by equal access to quality health care. Prostate cancer is a disease that affects Black men 3 times more than every other racial and ethnic group. Yet when you see the commercials on television for where you can go to get robotic surgery, which is gold standard, notice how you see very few black men in any of these commercials recruiting for our community, letting them know that they can come there. There's very little information out there in our community to tell you, by the way, if you get prostate cancer, to prevent the erectile dysfunction that may happen and all of the other complications, you want to look for these robotic places or places that do minimally invasive radiation therapy. And our community doesn't know about this, and this is what I'm talking about. And yet this is, in many ways, a black man's disease. We get it 3 times every other racial and ethnic group, and we don't have the same equal access to quality health care, nor are we included in the clinical trials to look at what's the best care when, in fact, we get the disease more than everyone else. And at younger ages.
And the whole thing, of course, around clinical trials, we know with the whole Tuskegee disaster, many blacks are still discussing it, and we were very surprised somewhat. We had focus group with young black gay men, roughly between the ages of 18 to 24, and they actually introduced that as a part of their concerns with respect to PrEP, pre-exposure prophylaxis, in terms of preventing the transmission of HIV and AIDS. So clinical trials extremely important as part of our education in the community. So you also have a conference coming up, right?
Yes,
Roslyn?
we have our Black Health Matters Summit on March 14th in Harlem at Riverside Church. And that's the opportunity for us, like you said, to really bring, and so we have some invitations that will be extending, so you'll be hearing from us. The way to be able to offer access to phenomenal physicians and scientists whom, like yourself, are passionate about what they do. You know, in our line of work, we come across conferences and we go to all of these different types of meetings, and we meet physicians and scientists that are really game changers. And that after you hear what they have to share, when we learn more about what the advances are and the prognosis are for certain types of cancer and cures and, you know, sickle cell, there are new treatments there, you really become excited about what is out there. And so what we wanted to do was to share that in a grassroots setting, bring these same experts, these medical scientists, into the African American community and just unleash them so that they can share the information. And what we found is you could hear a pin drop. People are interested in these clinical discussions. So we can't underestimate the interest level of the attendees, because they really want factual, evidence-based content presented by someone who cares.
And I think that's what we find as we move around the country. Of course, we're a national organization, and as we host town hall meetings, so far we've had them under this new rebranding under the name of the National Black Leadership Commission on Health here at Harlem Hospital in New York City, in Tampa, Florida, in Long Island, Syracuse, New York. We have scheduled ones coming up in Atlanta, Detroit, and in DC. And as we move around the country, the interest level is just incredible. And it speaks to exactly what Roslyn just said, that our communities are interested. We just have to take it to them. And then we have to be consistent and persistent. So I just think that everything that you're saying, especially Dr. Petersen, with the work that you've done, that you continue to do up in the Bronx, and you've seen a turnaround, then maybe we need to package that and say, okay, this is how it is done. And if we can do it in these other cities, perhaps we can show results.
Yeah, and I call it taking healthcare to the people. We've actually, for too long, waited for people to come in to get the healthcare. No, we should be going, because when we got rid of all these community health centers and these organizations where people could get care, we started expecting people to show up on our doorstep, and that doesn't work in our community. It's now time to, like you said, package and take healthcare back out to the people. I think it's very important.
Okay, well, with the closing few minutes that we have, I'd like to ask both of you to say if there's anything that you would like to add that you want our viewers to know. And since we are, again, focusing on the important work and discussions that were led by Dr. King some 54 years ago, say, and I don't like this question, I hear it a lot, but I'm going to say it. if Dr. King were alive today, what do you think he would say about the disparities and where we are still today?
He would be disappointed because there have been so many years have gone by, but there's time. This is a time to be hopeful. If we start to immerse and harness the power of what is out there for us, we can really eliminate these health disparities. Again, Black Health Matters is open 24 hours a day, 7 days a week. So we have health literacy, health information that is going to help you make better informed choices. Your organization is there to provide support and resources. So again, this is a time to be hopeful and to persevere.
Yeah, and everything you said, and I think the other thing I think Dr. King would say to us is that the fight continues, but you don't have any fight in you if you don't have your health. And so it's important to take care of yourself because you got to be out there in the front lines fighting, and you're going to need your health to do that. Yeah.
And that is why, again, advocacy is so incredibly important. And make sure that we push for policies that support the resources in our communities that are also needed. I can't thank both of you enough for everything you've shared, and this is such an exciting beginning of this new year and this new decade. So I'd like to thank Roslyn Daniels and Dr. Bert Petersen for joining us today. And for more information, we encourage viewers to visit our website, NBLCH.org. And also look for us on Facebook, Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact your health and well-being. So please let your family, your friends, and your neighbors know about this programming. Again, I am C. Virginia Fields, and I thank you for joining us and hope you'll tune in next time for Health Action TV here on Manhattan Neighborhood Network.